Hey everyone, welcome to The Explainer. Today, we're unpacking a topic that is profoundly misunderstood by the general public, yet intimately familiar to millions. We're looking at the complete reality of epilepsy. Sure, we'll talk about what physically happens in the brain, but more importantly, we're going to explore this massive, unseen iceberg of what it actually means to live with this condition day in and day out.
Okay, let's dive right into this. To put things in perspective, right now, there are about 50 million people worldwide living with epilepsy. 50 million! That's a huge number. It actually makes it one of the most common serious neurological disorders on the planet. So this isn't some rare, isolated condition. It's a massive global reality affecting people across every single demographic, with nearly 80% of cases occurring in low and middle-income countries. So, with 50 million people affected, you've undoubtedly heard the word before. But what is it exactly? I mean, before we get into the deeply human side of all this, let's just quickly map out what's physically happening inside the body. Section 1. The electrical storm. The physical, medical reality.
At its core, epilepsy is a predisposition. It's defined as a group of neurological disorders characterized by a tendency for recurrent, unprovoked seizures. Now, the absolute key word here is tendency. Having a single seizure because of, say, a severe head injury or a drastically high fever, that doesn't mean you have epilepsy. It's an enduring, chronic state where the brain is fundamentally wired to generate these events spontaneously. Which brings us to the actual acute event itself. A seizure is a sudden burst of abnormal electrical activity in the brain. Just think of your brain's neural network as this highly synchronized, beautifully orchestrated communication system relying on a really delicate balance of excitatory and inhibitory signals. Well, a seizure is literally an electrical storm that suddenly just overwhelms that balance, completely disrupting normal signals and causing everything from brief lapses of awareness to prolonged physical convulsions. Now, these electrical storms basically fall into two main camps. First up, we've got focal seizures. These originate in one specific area of the brain, kind of like a highly localized storm cell. The person might actually remain completely aware, or their consciousness might just be slightly impaired. On the flip side, we have generalized seizures. These storms start at a specific point, but then spread incredibly rapidly across interconnected networks in both hemispheres of the brain, typically causing an immediate loss of consciousness and full body involvement. So once we map this neurological storm, how exactly does modern medicine attempt to solve the problem?
Section 2. Medical management, solving the problem.
Well, it turns out modern pharmacology is actually incredibly successful for a lot of folks, and the numbers brilliantly illustrate this. Roughly 69% of epilepsy cases can be effectively controlled with anti-seizure medications. For the vast majority, taking a daily med stabilizes that electrical activity by regulating ion channels and neurotransmitters. They can literally go months, years, or even a lifetime without another storm. But that still leaves about 31% of cases where the seizures are completely drug-resistant. So what happens when meds fail? Medicine turns to some highly technical alternative interventions to try and calm the brain down. We're talking about resective surgery, where the specific focal point of the brain causing the seizure is carefully removed. Then there's neuromodulation, like vagus nerve stimulation, which acts almost like a pacemaker to deliver controlled electrical impulses that interrupt those abnormal signals. And we also have dietary therapy, primarily the strict, high-fat, low-carbohydrate ketogenic diet, which alters the brain's metabolism and has proven really effective, especially in kids. But look, all of this, it's really just the tip of the iceberg, the visible seizures and the clinical treatments. Now, we need to dive beneath the surface.
Section 3. The invisible burden. Beneath the surface.
Now, what's really fascinating about the academic research is that it reveals something pretty profound. The literature shows that this condition goes so much deeper than physical tremors and clinical interventions. Patients face intense psychological challenges that drastically impact their overall quality of life, or QOL. The emotional distress is constant. The studies actually point out a pretty shocking paradigm shift. They note that depression is notably prevalent, with studies indicating its significant role in reducing quality of life, often independent of seizure control. You'd naturally assume that if the medication works and the seizures stop, the patient's quality of life just automatically bounces back to normal, right? Actually, the research says otherwise. The anxiety, the sheer unpredictability, the shared neurobiological pathways of mood disorders, all of these persist even when the physical storms are totally quiet. And compounding all this deep emotional distress is a very real cognitive toll. Get this, about 30 to 40% of patients experience cognitive deficits in memory, language, and executive attention.
For instance, in temporal lobe epilepsy, patients often show deficits in theory of mind, which is basically the ability to understand other people's emotions and intentions. Just imagine how exhausting it would be to constantly struggle to find the right word, or to lose track of conversations, or to misread social cues. These cognitive impairments make it incredibly hard to engage in normal social situations, building this invisible wall of isolation around the patient. And this internal struggle inevitably clashes with the outside world.
Section 4. Stigma and Isolation. The outside world. The stigma around epilepsy is sadly pervasive across the globe, and it breaks down brilliantly into two distinct types: felt stigma and enacted stigma. Felt stigma is that internalized, invisible weight, the deep shame, the constant fear of having a seizure in public, the anticipation of embarrassment that causes patients to withdraw and just isolate themselves. Enacted stigma, on the other hand, is the overt, tangible discrimination they actually face out in society, being denied a job, facing strict driving restrictions, or experiencing outright rejection in relationships just because of lingering archaic misconceptions about the condition. And the impact of this societal judgment? It's staggering. Studies show that social stigma alone accounts for 26.2% of the variance in depression scores among patients with epilepsy. Let that sink in for a second. Over a quarter of their depressive symptoms can be directly tied to how the outside world views and treats them. This isn't biology anymore, guys. This is entirely preventable distress caused by society. And of course, this condition doesn't just isolate the patient. It creates a massive ripple effect throughout their entire support system. Parents of children with epilepsy experience extreme stress and role restriction, stress that studies show doesn't even fully go away after a successful brain surgery. In adults, the condition is consistently linked to lower marriage rates, higher divorce rates, and severe financial strain due to medical costs and underemployment. The illness strains marriages, drains family finances, and absolutely overwhelms caregivers. So if the pill or the surgery only treats the physical electrical storm, how do we treat the rest of the iceberg?
Section 5. Treating the whole person. Looking beyond the seizure. So the crucial point here is, to truly support patients, we absolutely must utilize therapies that address the mood disorders and social isolation right alongside the physical seizures. And the good news is, we're seeing great promise in holistic interventions, things like cognitive behavioral therapy to directly help manage depression and anxiety, mindfulness-based interventions that teach acceptance and awareness of negative emotions, and structured self-management programs like the Z-Mail program, which empower patients with education, goal setting, and proactive coping strategies to reclaim their autonomy.
Ultimately, true treatment isn't just handing over a prescription pad. It requires a multidisciplinary team. We need neurologists working hand in hand with psychologists, dietitians, social workers, and counselors. We have to address the psychosocial, the vocational, and the long-term emotional challenges in a highly coordinated way. We've got to manage the mind, support the family, and educate the environment, not just regulate the brain's electrical pathways. Which leaves us with this final, incredibly powerful question. Are we treating the seizure, or are we treating the person? When we look at chronic conditions like epilepsy, we have to look past the visible symptoms and see the entire complex human experience beneath the surface. Thanks so much for joining me for this explainer. Keep learning, stay curious, and I really hope this changes the way you view the unseen challenges all around us.